Hi, my name is Brad Siff. I'm very happy to welcome you to our 10th webinar. And this webinar that I'm going to present to you is on BioWave pain treatment applications using the silver knee BioWrap. I just want to remind you that at the end, we will have a live Q&A. So please enter your questions via the Q&A tab in the bottom middle of your window. BioWave pain treatment applications using the silver knee BioWrap. So this is an image of the BioWrap on a knee. This is specifically on our permanent silver fabric electrode technology BioWraps, hence we call them the silver knee BioWrap line. One of the biggest advantages of using the BioWrap technology, in the case of the knee, it provides 3 times the treatment area. We can treat 3 times the volume of tissue as compared to conventional hydrogel electrodes that also work with our BioWave devices. So these BioWraps contain an advanced, highly conductive, permanent silver fabric electrode inside. The BioWrap provides compression simultaneously while allowing the delivery of our high-frequency signals into deep tissue. There's no guesswork as to what the proper placement is for the electrodes. They're reusable, they're easily cleaned, and we provide a 1-year warranty on these BioWraps. The silver BioWraps are compatible with our BioWave Pro high-frequency neurostimulators and our BioWave Home high-frequency neurostimulators. They do not work with BioWave Go. These BioWraps, the knee BioWrap comes in 2 sizes, in a small medium and in a large, extra large size. And the small medium can work on knees where if you measure the circumference around where the kneecap is located, anywhere from 12 inches to 15.5 inches in circumference. And the large, extra large covers knees that are from 15.5 inches to 19 inches in circumference. Also, this design can be used on either the right knee or the left knee. It works on both knees. We're going to look here at the construction of the knee BioWrap. On the left side, we're looking at the inside of the BioWrap, and these are the compression straps coming off of the BioWrap. There's a directional indicator here, which shows you how the BioWrap should be oriented before you move it to place it on your knee. The built-in silver fabric electrodes here essentially allow coverage from the lateral side of the knee right across the anterior to the medial side of the knee. We can really capture a very large portion of the knee. This hole is here as a kind of a landing point. It's centered directly over the center of the patella, the kneecap, so it's very easy to orient this and get it placed in the correct position. On the outside of the BioWrap here are the 4-inch snap cables. These are attached to the backside of the silver fabric electrodes. Each snap cable runs through a tunnel, and the blue connectors at the bottom of the snap cables plug into the lead wire cable that comes with your BioWave device. These blue connectors here can plug into either end of the 2-end portion of the lead wire cable. And finally, over here, the compression straps have Velcro closures that help them stay completely securely closed when you're attaching this to yourself. So because we're able to capture such a large region around the knee and get a good depth of penetration of our active electrical field, we're able to target most of the nerves running through the knee. And so this includes the peroneal nerve, the tibial nerve, the inframedial genicular nerve, the infralateral genicular nerve, the recurrent fibular nerve, the saphenous nerve, and the lateral sural cutaneous nerve. So we really have the ability, because we're capturing such a large region on the anterior to lateral side and anterior to medial side. This is a really useful tool to target most types of pain conditions. In terms of the structures that we're targeting, again, for the same reason, because we're actually able to capture such a large volume of tissue, we're capturing, for example, the ACL, the anterior cruciate ligament, the medial collateral ligament, the lateral collateral ligament, and the fibular collateral ligament. We're also capturing the medial meniscus, the lateral meniscus, and we actually can capture the patellar tendon. The electrical field that forms beneath the two electrodes built into the BioWrap form surrounding as well as beneath each electrode. So you're really getting across the anterior portion of the knee as well. In terms of the types of pain conditions that the BioWave active electrical field can treat, this really, when you're using a BioWave Home or BioWave Pro high-frequency neurostimulator combined with the silver fabric Knee BioWrap, it really is a great first course therapy for treating both nociceptive as well as neuropathic pain conditions. And BioWave in combination with the BioWraps is indicated to treat any type of chronic, acute, or postoperative pain. So for example, chronic pain conditions we can treat around the knee include osteoarthritis, and it can be grade 3 or even grade 4 osteoarthritis of the knee. We can treat tendinopathies like a patellar tendinopathy, and we can treat IT band syndrome where that pain is presenting right at the lateral point of the knee where the IT band attaches. From an acute pain standpoint, we can treat really any type of ligament sprain that occurs in the lateral, anterior, or medial portion of the knee. So that includes ACL, MCL, and LCL sprains. We can treat pain that results from meniscus and or cartilage tears. We can treat pain that results from bursitis and or tendinitis. And we can even treat pain that would result from dislocation of the kneecap of the patella. From a postoperative standpoint, this is a wonderful tool to help facilitate motion and function and accelerate rehabilitation. So it's a great tool for total knee replacement patients, for patients who had ligament reconstruction surgery, or for example, if you've had meniscus repair surgery. So these are typical examples of the types of pain conditions that the silver fabric Knee BioWrap can be used for. In terms of directions for use, it's pretty straightforward. Now, in order for our devices to deliver our high-frequency stimulation through these much larger area silver fabric electrodes, we have to reduce the impedance of the skin. And we do that by applying a small pea-size amount of conductive cream that we provide, BioWrap conductive cream, directly and onto the skin in the regions that the silver fabric touches the skin. So you would apply a pea-size amount to each of your fingers and then rub it in on the lateral, medial, and across the anterior portion of the knee. It doesn't matter if it crosses over from where one electrode touches the knee or to where the other electrode touches the knee, as long as it's rubbed into the skin everywhere that silver fabric touches the skin. That's really what's key. The next step is you're going to line this up so the hole is centered directly over your kneecap. Both 4-inch snap cables should already be snapped on and running through the tunnels, and the connectors should be extending down to the bottom. You actually, before you line it up, it would be a good idea to attach the BioWave lead wire cable from your device to the 2 blue connectors at the end of the snap cables. So you're gonna do that, line this up right over the center of the kneecap. Then we're gonna start with the top compression strap. You're gonna thread it through the D-ring here and then pull it back across the front. We're gonna start with the upper compression strap, and we're going to thread it through the top D-ring. You want to pull this strap so the elastic is tight, and while you're doing this, make sure that the hole stays centered over your kneecap. Next, we're going to pull that compression strap tight and then pull it across the front of the BioWrap, and you're going to secure it in place using the Velcro closure and pushing it right into the neoprene portion of the BioWrap. Again, while you're doing this, make sure that hole is centered right over the center of your patella, your kneecap. Next step is we're going to work with the lower compression strap. Just like the upper one, we're going to thread it through the D-ring. We're going to pull it tight. Again, while you're doing this, make sure that hole stays centered over the center of your kneecap. And then you're going to pull that strap across the front and Velcro it tight to secure it in place. And so whether you're on the right knee or the left knee, this procedure, the directions for use are identical. In terms of troubleshooting, one possible issue that might come up is the connection error. So for example, let's say that your skin is, or the patient's skin is very dry, and or the patient forgot to apply the BioWave conductive cream. This is a condition where the skin impedance is too high. So what happens is the BioWave device is not seeing the silver fabric electrodes on the skin. So in this example, this image on the right is of a BioWave home screen, and it shows 2 electrodes with an arrow to the body, meaning it doesn't see that those 2 electrodes attached to the body. And so the way we correct this is remove the BioWrap from the knee, apply more generous amount of conductive cream over the region where the silver fabric is going to touch the skin on the lateral and medial and across the anterior portion of the knee, and then reattach the BioWrap to the knee. And then that should correct this error condition. And then you would start the treatment by pressing the plus button on your BioWave device and increasing the intensity. If a less likely scenario, but it's possible it could happen depending on your skin type, is if the patient applied too much conductive cream on across the knee, and this would cause the skin impedance to be too low. And if that happened, you'd have the same error condition. The device is not seeing these the silver fabric electrodes on the body. So to correct that, you would take the BioWrap off and take a dry towel and just wipe away any excess conductive cream that's on your skin, and wipe away any excess, if it exists, that's on the silver fabric itself. And then reattach the BioWrap as per the directions. And then this error condition should go away, and you should be able to, the patient should be able to start the treatment by pressing the plus button and increasing the intensity. One last possible troubleshooting situation is if the treatment sensation doesn't feel strong enough. So you've put on some conductive cream and you're increasing the intensity, but you're able to go right up to like 80, 90, or 100% intensity. To me, that indicates that the impedance is still too high. And so there's 2 variables, 2 ways to fix this. Take off the BioWrap, apply more conductive cream to the medial, anterior, and lateral side of the knee, and then put the BioWrap back on. You can also make the BioWrap tighter by making the compression greater. That's going to cause a stronger treatment sensation. Similarly, if you feel the sensation is too strong right when you're starting to increase the intensity, then pause the treatment and so the first thing you can do is loosen the compression of the BioWrap. And if that will cause the treatment sensation to be less. If it still feels too strong, you can remove the BioWrap, take a dry towel, remove any excess conductive cream, then reapply the BioWrap. Make sure the compression's not too tight. That's a little bit on the looser side, but still snug, because that silver fabric electrode has to be pressing against the skin. And so that will make the treatment sensation a little bit less. So again, the key points here being tighter compression and or more conductive cream provides a stronger treatment sensation. Looser compression and or less conductive cream provides a lower or a less of a treatment sensation. And that's a little treatment tip for how to manage the sensation if you're ramping up right to 100 or you can't get past 2, 3, 4% when you're first starting. From a protocol standpoint, it's really the same as if you were using our reusable non-invasive electrodes. It's a 30-minute duration treatment. We recommend 2 to 3 treatments per day when you're first starting out with this. And you want to separate each treatment typically by about at least 30 minutes. You can separate them by much more time, but if you wait at least 30 minutes, it allows the body to come back to a normal state, and then you're hitting it again with a second treatment. But if the patient is having a bad pain episode day, they can treat on an as-needed basis. There's no limit to the number of treatments. If they need to do 4 or 5 treatments in a day, that's totally fine. And both physicians and other providers and patients report that there's a cumulative benefit with multiple treatments over time. In terms of contraindications, it's really the same as those when you're using the BioWave device. If the patient has an implanted cardiac pacemaker, they cannot use this device. And very importantly, this silver fabric the silver fabric electrodes within the Knee BioWrap have to be placed over intact skin. So if in the region where the silver fabric lines up over the knee, there are open wounds, broken skin, rashy skin, or sensitive skin areas like sunburned skin, you can't do a treatment with this device because you have a risk of a burn or irritating the skin further than it already is. So just make sure that the skin is intact and there's none of these issues in the skin in the area that you want to treat. Also, importantly, BioWraps may be placed over or in the proximity of implanted orthopedic hardware, including metal hardware like total joint replacements, anchors, plates, rods, screws, pins, and clips. So you can treat directly over these types of implanted orthopedic hardware that are inside your knee. Totally fine. From a cleaning standpoint, you can clean just the silver fabric portion of the electrodes using an alcohol wipe like the Purell brand hand sanitizing wipe. It has no negative impact on the conductivity of the silver fabric. Do not use any type of wipe that has any chemicals in it other than alcohol. The BioWraps, if you want to wash the entire BioWrap, it may be hand washed, and you want to use mild soap and water. You can use your hands in a sink with some mild soap to clean it, and or even use a washcloth over the silver fabric or other areas of the BioWrap. Before you do this, please disconnect the 4-inch snap cables on the back side. Unsnap it, slide it through the tunnel, take them off, then clean it with soap and water. You can pat dry the BioWrap when you're done. You can pat it dry with a towel, and you can let it sit on a towel and air dry. Please do not wash it in a washing machine. Do not put it in a dryer, and please do not dry clean it. These steps will cause the silver fabric to deteriorate, and you will not be able to get as good a treatment. It also voids the warranty on this. So please just hand wash and dry with mild soap and water and a towel. So I want to thank you for attending our webinar. As a reminder, please submit your questions under the Q&A tab right at the middle of your screen. If you do have questions, if you're watching this webinar on our website because you weren't able to attend the live one and you have questions, please contact us at 1-877-BioWave, or you can email us at info@biowave.com. Thank you very much for your time today.
Hi, so if anybody has any questions, please submit your questions in the Q&A box at the bottom of the screen. Okay, so I actually have a couple questions here. So one question is the Knee BioWrap something you'd purchase or lease? And so it's something that would be purchased. We don't lease them. So when you get a prescription for your BioWave home device, you would typically be getting a prescription for a Silver Knee BioWrap as well, presuming you have knee pain. Another question is, do you need to be seated throughout the whole treatment session, or can you get up and move around? With the Knee BioWrap, you actually can get up and move around if you want to. The Knee BioWrap does not allow full 90-degree flexion of the knee, but you have enough ability, there's enough flexion built into the neoprene BioWrap that you can comfortably walk around and do things around the office or your house or whatever. Here's another question. It says, you mentioned solutions for low or high impedance, for example, adding more cream or wiping away cream. Does the error message on the device let you know if the impedance is too high or too low? Or does it just tell you that there's a problem? That's actually a very good question. The error condition that the device shows just shows that the device doesn't see the electrical connection to the pads on the body. So it's not telling you whether it's a high impedance or low impedance issue. So based on the troubleshooting portion that I described, you'd have to make a determination that you need to either add cream or more compression, or remove cream and maybe a little less compression. So unfortunately, the device can't tell you that. Here, there's another question. Can the wrap be worn during regular movement or walking? Actually, that's similar to one of the other questions I answered. Yes, the answer is yes. You can definitely move around. You can walk. Like I said before, you just can't do a full 90-degree flexion with the wrap on, but there's enough range of motion that you can definitely walk around with it. Okay, so again, thank you very much for your time. If you do have questions, please don't hesitate to call us at 1-877-BioWave or send us an email at info@biowave.com. Thank you, and please come to our next webinar next month. It'll be around mid-January. Here's one more question. So before I go, this is a good question. Actually, there's two more questions. So one question is, why can the Knee BioWrap not be used with BioWave Go? And the reason is because the BioWave Go is designed as an over-the-counter device, and the impedance range in which it works is limited. So when you put the cream on the knee to lower the impedance so that we can drive the signals from the device through these much larger area electrodes, the BioWave Go device can't work at that lower impedance range. And that's the reason you can't use it with a silver fabric BioWrap. But we do have a blue series BioWrap, and we have a knee version, and we have a lumbar version that do work with BioWave Go. So the blue BioWraps, which use conventional electrodes, but you're getting the benefit of the compression, and there's markings inside those blue BioWraps as to where the electrodes are placed, and they have Velcro backing so they stay in place. Those can be used with the Go BioWrap. And then I have another question. Can your device beneficially treat ankle pain using individual electrodes? If so, do you have electrode placement diagrams? We can do this offline. Yes, we absolutely can treat any type of pain condition around the foot or ankle. We actually also have a foot ankle BioWrap, and we have a circumferential electrode just proximal to the ankle and one that's just proximal to the metatarsal region of the foot. So when you stimulate with that, you stimulate from the entire ankle all the way down to the toes. So if you have a patient, for example, with painful diabetic neuropathy, that's a wonderful tool. But you can also use individual electrodes to treat specific point issues on the foot or ankle. Please feel free to contact one of our customer service specialists at 877-1877-BioWave, and we can answer further questions on that as well. There also is a foot ankle BioWrap webinar. If you go to our website and you look through the webinars, you can find that webinar, and that would give you all the various applications and nerves and types of pain conditions that the foot ankle BioWrap can be used for. I think that's everything. So again, thank you very much. And any further questions, please don't hesitate to reach out to us. We're here to help you. Thank you.